Good morning, class. Today is April the 27th. I'm sorry that I can't be there with you today. And of course, this is Dr. Scott, your instructor for Med 235. However, I have prepared this lecture for you for Chapter 34. Chapter 34, which actually in your textbook begins on page 657, is about the endocrine system. So the endocrine system is all about hormones. And hormones pretty much control everything about you. After you have watched this video, I want to make sure that you complete an assignment that's required to complete by 1 o'clock. It's an in-class assignment, so you must watch the video first, and then you complete your assignment. It'll be 15 questions, and you have 15 minutes to complete it. So let's go ahead and begin. The endocrine system, as I said, you're on page 657, and there's always a good case study at the beginning of the chapter. They're talking about a gentleman who's actually saying that he feels a little bit odd and he's been losing weight. So you can always begin the chapter that way with a case study. And also, of course, your key terms on page 657. And then turning over to page 658, you have the introduction to the endocrine system, which I'm hoping is all reviewed from your anatomy and physiology class. The endocrine system has to do with, once again, like I said before, hormones. Hormones are really vital because hormones control and regulate pretty much a lot of activities that cells do. So it controls organs, tissues, and other cells. Hormones don't need permission to come into a cell. It's kind of like a burglar. They can just kind of break in and cause different reactions to occur. Of course, you have glands that secrete hormones. The hormones, when it's the endocrine system, endocrine meaning within, right? Endo meaning within the endocrine system. So the glands secrete the hormones actually go into the bloodstream, and then from the bloodstream, they actually reach certain target tissues. So there's a really good picture on page 659 that actually shows you the different glands that are secreting certain hormones, and it also describes where those hormones are some of the target tissues. Once again, on page 658, it's still discussing the endocrine system. Remember, endo meaning within. So the endocrine system is ductless. So in other words, it's not like a sweat gland in which the sweat actually kind of comes out. The hormones actually go directly into the bloodstream, and then from the bloodstream, just like the previous slide you saw, from the bloodstream it goes directly to target tissues. And target tissues meaning that those are the tissues that respond best to those particular hormones. Hormones are also chemically secreted by cells that affect the functions of other cells. So the glands are actually made up of cells that actually end up going into the bloodstream and affecting target tissue. For example, thyroid stimulating hormone, or TSH, is a hormone that's actually made in the anti-pituitary or antipituitary, and actually its target tissue is the thyroid gland. With hormones, it's important to have what they call negative and positive feedback. For example, on the slide that you see, which is also the PowerPoint, remember your PowerPoint is also on your Moodle shell, is that what you can kind of see here is when the patient actually eats, right? So when you eat something that raises your glucose levels, it'll actually cause the pancreas, right, which has a few different cells, but beta cells in the pancreas will actually cause insulin levels to go up. So when the insulin levels go up and you have a lot of glucose in the bloodstream, the insulin is actually what causes you to push the glucose into the cells, because without insulin, the glucose cannot get into the cells, right? And that therefore causes a negative feedback. Okay, what you're trying to do is, with the increase in blood sugar, you want to make sure the blood sugar levels actually go down as to not cause a problem. For example, like you would have with a diabetic patient. Diabetic patients, remember, have issues with their insulin levels. A positive feedback loop would be what you're seeing here. And that would be, for example, a mother who has a baby who's suckling. In the hypothalamus, you'd actually have the oxytocin that would actually get sent to the posterior pituitary. The oxytocin, so the suckling would actually cause a milk release from the mammary glands in breast tissue. So that's actually positive suckling. The suckling causes a positive response and thus causes the milk to be released, and of course the baby gets fed. And if women are able to breastfeed, that's actually, of course, the best medicine and nutrients for the baby. So we're still on page 658. Hormone production is really important. So the hypothalamus, even though the pituitary is often called the master gland, I like to call the hypothalamus the master to the master gland, because the hypothalamus is right above, if you can kind of see in that picture, also on page 659, the hypothalamus is right above the pituitary. So it's kind of a small depicted, but you can see it better in your picture. And so the hypothalamus actually secretes and makes oxytocin and ADH. So oxytocin and ADH, or antidiuretic hormones, are actually released from the posterior pituitary. And make sure that we review. The pituitary gland is actually divided up into an anterior and a posterior proportion. The posterior only releases two hormones which are actually produced in the hypothalamus, and that's oxytocin and ADH. Those are always good test questions. So you can kind of see the pituitary gland here. And the pituitary is actually, as I said, has an anterior and a posterior lobe. And it actually settles in this, what they call silica turcica. It actually settles there, and it's kind of like a nice fit. So when you have a tumor there, you can see how you really, if they're able to operate on it, they would want to, because there's not a lot of room in the skull. So the hypothalamus tells the pituitary what to do. So once again, you can kind of see the hypothalamus here, and the pituitary is actually instructed by the hypothalamus. And as I said, remember, a good test question is, the pituitary is divided into an anterior lobe and a posterior lobe. And right now, I'm on page 660 and going over to page 663. The anterior lobe, which actually I said is a nice picture, there's a nice picture on page 659, and then there's a nice table on page 660, produces a lot of hormones. One that's really important is your growth hormone. Growth hormone is really important, as you can see here, kind of like what the name sounds like, increase in size and muscle of muscles and bones, and also repair of tissues. But kind of think of someone who has too much growth hormone might actually develop into a giant or have gigantism. So think about somebody like Shaquille O'Neal. He's pretty tall. You know? Melanocyte-stimulating hormone is a northern hormone that's produced in the anterior lobe, and that actually has to do with the amount of melanin that you secrete. So with people who are maybe, for example, albinos, they don't really have the melanocytes that function very well. Therefore, they're pale. Adrenocorticotropic hormone, or ACTH, it stimulates the adrenal cortex. Does anybody remember where the adrenals are located? Remember, the adrenals are located on top of the kidneys. They're like little caps. And the adrenals are also really important for stimulating epinephrine and norepinephrine. So remember, that's like your adrenaline. And so the ACTH is what stimulates the adrenals to release epinephrine or adrenaline. Thyroid stimulating hormone, which we've already mentioned, or TSH, is also released from the anterior lobe of the pituitary. Remember that the thyroid stimulating hormone, or TSH, is stimulating the thyroid, so that's this target tissue. The anterior lobe also secretes these other hormones like FSH, LH, and prolactin. So you see a lot of, when you talk about prolactin, prolactin is actually the hormone responsible for milk production. And remember that oxytocin, so for women who actually gave birth naturally, they may have been given Pitocin, which is the artificial version of oxytocin. But we're going to talk about that in the next slide as well. The posterior pituitary, remember, only releases antidiuretic hormone and oxytocin. So antidiuretic hormone, which we'll talk about later as well, has to do with a condition called diabetes insipidus. So when a patient has an issue and has low levels of antidiuretic hormones, they have a tendency to have polyuria, or they urinate a lot. It's also important to have ADH to maintain your blood pressure. Oxytocin, as we mentioned before, is really important for milk release versus prolactin, which is important for milk production. So remember, ADH and oxytocin are released from the posterior lobe, but they're actually made by the hypothalamus. That's also a really good test question. So right now, we're on page 662. Thyroid gland, which is also on page 662. Remember that TSH is made from the anterior pituitary. And so thyroid hormones made by the thyroid gland are pretty much needed for almost every single cell in the body. So when you have an issue in the thyroid, it's going to cause a patient, for example, if you don't have enough thyroid hormones, it may cause a patient to develop hypothyroidism. So thyroid hormones, when at normal levels, help to increase energy production, protein synthesis, and also help to speed up damaged tissues. Those are just some of the things. Calcitonin is also released. Calcitonin is actually about lowering blood calcium levels. Now the thyroid gland is also kind of interesting. It actually has 2 sets or 4 parathyroid glands on the back of it. And it actually produces something called parathyroid hormone. Parathyroid hormone is all about increasing calcium levels. So if your body notices it doesn't have enough calcium, it'll actually start releasing PTH, and thus it'll actually go to osteoclast. Osteoclast will actually go to bone and start breaking down bone to release calcium. So you got to drink your milk or eat your dairy or have your leafy green vegetables so you get enough calcium. And I'm still on page 662. The adrenal glands, remember we mentioned that? The adrenal glands actually have an adrenal medulla and an adrenal cortex. The adrenal medulla, which remember we have that ACTH, which stimulates the adrenal medulla, is responsible for helping to produce epinephrine, norepinephrine, or adrenaline, right? So it's really important for that. That's kind of your fight or flight hormone. The adrenal cortex, which is kind of the outer part of the adrenal gland, produces aldosterone and cortisol. Remember, cortisol is really kind of infamous for being released when you're stressed. So as you sit and you study for classes, sometimes you release a lot of cortisol. But remember, when you release cortisol, that also decreases inflammation. It also decreases your immune system. So what you notice as students sometimes is when you're really stressed about a homework assignment, you have a tendency to get sick really easily. So don't stress. And I'm still on page 662 from your book. The pancreas. The pancreas is really kind of interesting. It actually has exocrine and endocrine function. Exocrine meaning that it actually has a duct system. So what you can kind of see here is the pancreas, and that's kind of the duct here, which would actually go into the duodenum or duodenum. And so you produce what they call pancreatic enzymes. Right? Digestive enzymes. Remember the endocrine gland itself, the endocrine part of the pancreas, has the hormones that go directly into the bloodstream.